Good morning, everyone. I am here at close to a lake here. I just came for a walk, but what I am going to discuss is something important for you guys. This is about how to handle an interview in an Australian setting, say at an Australian medical job application. For instance, if you apply for a job in a hospital, they will offer you an interview. Of course, you have to have your AMC Part 1 and English, OET, IELTS, or even PTE. Once you have your AMC Part 1 and English qualifications, then you can apply for jobs at hospitals, like especially for postgraduate year 1 jobs, postgraduate year 1, 2, 3, those jobs, or PGY 2 and 3 generally for the people who registered elsewhere. Like for instance, if you are a Sri Lankan doctor and if you registered in Sri Lankan Medical Council, then if you got some experience behind you, then you can apply for a job in Australia. You can also apply for GP training jobs or GP registrar jobs or kind of GP jobs here. If you are an experienced GP in your country, if you have done say 4 or 5 years of GP work in your country or more than that, then you can apply for jobs. So if you apply for such jobs, then they will offer you an interview. In that interview, they will ask you some specific questions. Those are the things I'm going to discuss now. First and foremost, they would ask you to tell them that why you are interested in that specific hospital or that specific town or the GP clinic. Then the second question would be, they would be asking, what are you bringing onto the table, or what's your experience? And if they hire you as a doctor, what kind of things you can do for them. So this is where you sell yourself. Then you have to tell them, okay, I got this much of experience, this many years of rotations in Sri Lanka or India, for instance, and then you will tell them, okay, these are the things I will be bringing onto the table. And about why you interested in that area, you would be answering it's a critical question, but you will have to tell them, okay, what do you know about the area? Do you know what's the demographic is like? What sort of patient population in that town? And then why you interested in that area. So that's one aspect of it. So you have to do your homework. You have to read. Maybe Wikipedia may be helpful here. And the other thing is, you would of course tell them like you are interested about the specialist in that department or in that hospital and their background. So you probably have to tell them, okay, I have read about people who are working here. They're good people, they're helpful people, and then you happy to train or do your medicine under them in Australia. So that sort of thing would be what you will be telling them for the first question. Yeah. And then they would ask you some scenarios. Those scenarios may be, some would be clinical and some would be non-clinical. Non-clinical would be like how you handling a challenging situation. For instance, if your work colleague is doing something wrong or something unacceptable, how you handle that? Or if one of your work colleague complains against another colleague in your team, so how you handle that situation. Say for example, if a nurse complains that the intern is not doing their job properly, then how you handle that. This sort of situation, you actually get the story from either side of the story, you know, like you ask more explanation or more details from the nurse, but you won't be gossiping it around. And then you would, in a friendly manner, you'll be talking to your intern as well, try to get his or her side of story. It may be that they are struggling with their mental health, or it may be that they have family issues, or it may be that even like things like, okay, they may be playing games in the night and they may be tired during the day or something like that. So what's going on which is affecting their ability to work, or which is shown to the others as they are not working. So that sort of thing. If you find something which you can help, you would be telling the interview board that, okay, if I find something that I can do something for him, I will of course offer, as long as it's not affecting my ability to work. Okay, and if there is something serious going on, then you have to take it to the hierarchy, especially to your supervisor, and or you encourage your colleague to say talk to a psychologist or talk to a support worker from the work or something like that. So those are few examples. There are so many things they could ask. Things like, you know, they could ask, okay, tell us about a mistake when you're working, if you had a mistake, and then how you handle that. Like if you did something which is not the best thing for the patient, then how you handle that situation. This is about asking about open disclosure, so you will have to tell them how you did, how did you talk to the patient, or with whom you went and talked to the patient. Especially it should be with your supervisor. You first inform the supervisor about what happened. Say if you've given, for example, if you've given a wrong injection, or if you only given a diluent instead of the injection or something like that, then you know, talking to the practice principal if it's a GP practice, or talking to the supervisor if it is a hospital, like the consultant, and then you would perform what we call open disclosure. So that sort of thing would be asked in the interview. I remember in one of the interviews I went to, they asked about open disclosure. So those are sort of non-clinical scenarios. Clinical scenarios, of course, they could ask, it's depending on the population, right? If you go into a country town where a lot of older people are there, then they would give you a scenario. Okay, there is like a 75 years old person came to you, your emergency department, say, being confused, and then what's your approach? So it could be like, you know, delirium screening, and then, you know, all the history questions and what sort of examination things you would be doing, and then investigations, you know, including CT brain, for instance, and then they might come up to you and say, okay, they found some cerebral metastasis, and then, yeah, so what's your approach? That sort of thing, okay? And or if you got a reasonable pediatric population attending the emergency department or the GP clinic, then they might give you a case like, okay, febrile child or limping child, you know, like ruling out septic arthritis, non-accidental injuries, ruling out you know, osteomyelitis, all the bad things, and also simple things like transient tenosynovitis. So what do you ask in the history, what sort of examination, and what's your management approach? So those sorts of questions could be asked in an interview. Okay guys, I think you found something useful here. I will stop here and have a good day.